So if a patient overdoses on a benzodiazepine, we can supply a GABA antagonist called flumazenil. This drug binds to the benzodiazepine site on the GABA receptor and actually prevents GABA activity. However, you can actually precipitate a withdrawal seizure in frequent abusers of benzos. We can use flumazenil in patients that overdose on benzos, either in the IV administration, in an overdose of oral administration, and in a overdose of an oral administration of benzodiazepine combined with alcohol. Sometimes patients will attempt suicide by overdosing on these drugs with or without alcohol. Sometimes patients experience these drugs accidentally through ingestion of these drugs with alcohol at a party where a friend or somebody there gives them some pills and says, "Oh, this will be a fun mix to have," and then in 20 minutes or an hour, they've stopped breathing. So flumazenil can definitely reverse ingestion of benzos and even work in the context of alcohol administration. There are benzodiazepine-like drugs that have been used with really good success clinically for patients who have trouble sleeping. The two drugs here include zolpidem and azopiclone. Zolpidem, let me fix the frame. Zolpidem is a lipophilic, non-benzo-like drug with actions that are very similar to benzos. Specifically from a mechanistic standpoint, it's quite selective for the omega-1 receptor component on the GABA channel. We can use this drug in patients with really significant sleep disturbances. Those patients that sleepwalk or binge eat while sleeping, and even patients that drive while sleeping, but this drug has less anterograde amnesia. We see less muscle relaxation with this drug, and newer formulations exist where this drug can be put in a controlled release formulation. There are some cases of daytime drowsiness reported, however, from this controlled release formulation. In women, the dose has been dropped to almost half because there is a well-known and well-studied gender effect. But as to the reasons behind this, it's not quite clear. Maybe due to differences in terms of body fat percentages. Maybe there's a hormonal component to how this drug affects women, but it is well documented that the dose in women should be half of what their male counterparts may be receiving. This has pretty similar pharmacodynamics with other benzos. These are newer agents with a similar adverse effect profile as well. And then the other drug, which you've probably heard of, there's been lots of commercials on TV, azopiclone is under the trade name or the brand name Lunesta. This is another benzodiazepine-like drug that binds to sites that are near the benzodiazepine receptor binding site. There's little REM sleep rebound. REM sleep rebound is a phenomenon where there's an increase in REM sleep right after a night of little REM sleep. So sleep apnea is kind of a larger concern during a REM rebound. We usually run into REM rebound sleep when we've only had 4 hours of sleep or less the night before. Sleep needed for our brains to work properly. Obviously, proteins are made, hormones are released, memories are consolidated. We all know sleep is important, and none of us are getting enough. Correct. There is less risk, however, of this drug for dependence liability, which is a concept you'll learn about in an upcoming case.